I'm Dr. Louise Newson. I'm a GP and menopause specialist from the UK. I'm based in Stratford-upon-Avon, where I run a clinic, but I also have a free app called Balance, which is a global app, and I do a lot of education for women and healthcare professionals about menopause and hormone changes in women. Well, I've come because I'm part of this docu-series that's been developed. So I'm going to Dallas tomorrow to do an event. I'm a keynote speaker there, and I've been very kindly invited to this incredible event here today. Menopause is a global health problem. Only the minority of women are receiving treatment, about 5% of women. I'm a physician. I'm very evidence-based. I know that for the majority of women, hormones will improve not just their symptoms, but their future health as well. The stories that I hear day in, day out through my clinic, through my social media, through the app, of women who aren't being listened to, who are not being taken seriously. So many women who I speak to are offered or prescribed antidepressants, which we know is not a treatment for menopause. They're inappropriately being medicalized with not just antidepressants, but also drugs to lower their blood pressure, lower their cholesterol. We know that hormones will do that. What drives me to work and make a big impact is allowing women to have a choice. Women are often not given a choice, and that's a real problem. Not just in the UK or US, but every single country. Only the minority of women are able to access treatments because of these unfounded fears about hormone replacement therapy, which stem from 2002, a long time ago. So we've got a lot to do to unpick, but allow women to have the knowledge so they can make choices themselves. And that's really important. As a woman who works herself, who's also menopausal, I want to be able to work really hard. I've worked incredibly hard to get to where I am in my career. When I was experiencing symptoms 9 years ago, I couldn't think, I couldn't function, I couldn't string a sentence together, I couldn't remember things. What I wanted my employer to do was really to recognize what was going on and enable me to understand and hopefully get the treatment that was right for me. So many places in work, workplace organizations don't understand quite what menopause is. Certainly in the UK, there is a lot of talk about allowing women to be flexible with their working, to reduce their hours, maybe have a fan on their desk. Now that would not help my brain work, and it would not help me be promoted at work. We know around 10% of women who are menopausal are giving up their jobs, and the main symptoms are symptoms of fatigue, memory problems, and anxiety. So it's not about a different uniform at work, it's about addressing what's going on, why are these hormonal changes occurring, and allowing women access to evidence-based treatment. Having the conversation in workplace was crucially important, not just for those that are suffering, but for everybody else as well, because so often in workplace, women are signed off work with symptoms related to depression, or even, musculoskeletal pains are very common, so they're signed off with back pain or migraines, and no one's joining the dots and thinking, could it be related to their hormones? The other thing is, I see a lot of women who have premenstrual syndrome, PMS, or premenstrual dysphoric disorder, PMDD, in more severe form, and they're often dipping in their performance at work just before their periods. So they have a few days each month where they're finding it more difficult to work, to focus, to concentrate. When I see them as a clinician in my clinic, we'll give them natural hormones just for those few days. Then they can function, they can work. It makes such a difference. But we need to have these conversations because most of us see our work colleagues more than we see our partners and family at home, so working long hours. We did a survey not long ago actually and showed, we're looking at people who are working in the NHS. So NHS is a massive employer, as you know, in the UK. 37% of women were wanting to reduce their hours, but they couldn't afford to. And that figure really worries me. So maybe about a third of women who are experiencing symptoms are not doing the best of their jobs. They're going to work. They don't really want to be at work. As women, we want to be the top of our game. We want to be able to really be promoted in the way that we want. We want to be able to choose our careers. And the thought of this hormonal imbalance, these low hormones, stopping women from reaching their main potential, it is absolutely awful when we have a treatment that's available that women aren't able to access. So every country is struggling when it comes to menopause care and hormonal care for women. We know there's a massive gap. I worry about the health gap in women. It's not the age that we die, it's the journey to that age. We want to be well for as long as possible. And we're waking up to that. Certainly in the UK, we're thinking about it more. In the US here, I'm really noticing the energy. I'm noticing that women support each other probably quite a bit more than we do in the UK. They want to help each other, they want to understand, and they really want to learn so they can make a difference. So I think there's more going to be a quicker change in the US than perhaps there has been in the UK. We're quite reserved. We don't really look after each other in the same way. So that energy that I'm already hearing from different organisations, I think is going to make a big difference going forwards to the health of women.